Hi, everyone. Thanks for having me. It's good to be here. Thanks, Kiku. So, yeah, I mean, I don't think that would be news. I have a couple things in response to your first. I'll loop that into your second question, and kind of what Cynthia was saying about fear of the unknown. There's stress and anxiety, right, as an outcome of this and associated with this. Sometimes at the core of anxiety is this, I don't have a sense of control, right? And we right now continuously don't have a sense of control. And with a new diagnosis or an existing diagnosis, there's a lot out of folks' control when they're experiencing kidney disease. So that's inherently related to stress and anxiety. We feel anxious in that situation. The next thing, I mean, when we feel anxious and we feel anxious and we feel anxious over a prolonged period of time, like has happened in the world, we develop a sense of learned helplessness. I can't have an influence on my environment or something around me. And so I feel depressed. I feel down. My mood drops. I have sleep disruption. I feel worthless and helpless. And to some extent, some of these are true. I don't have the ability to impact some things around me, but that can change also, through therapy. And it's a great sign that folks are seeking mental health services at a higher rate now. At the same time, that's that's an indication that we're all struggling. And I think a third thing, that in response to the pandemic, but also something that especially impacts renal disease folks, is this reduced relationship quality and relationship conflict. I was working with somebody yesterday who said, I don't want to tell my wife that I feel down because then she'll feel down. And we actually got into it. How do you know she'll feel down? Well, I would feel down if she told me. Would you? Well, I guess sometimes. I would also understand where she's at. So how could you communicate to your wife that you're feeling down in a way that's not trying to get out of taking out the trash, but instead I'm going to do it in about an hour instead of right now? Okay, we could do that. So, part of this reduced relationship quality is we're not communicating as effectively with our partners, with our family members. And sometimes it is okay and important to say, I'm not feeling good right now. I'm feeling down. And let's pause and go into that. We don't have to dwell, but understanding could help. Happy to follow up with any of those.
Well, basically give the other person a chance to react to that. Don't just assume. Is that kind of what you're saying with that?
Yeah, give the other person a chance to understand your experience. And when you're done kind of explaining your experience, then try to understand their experience, tap into them, what's going on for them. What do I do that impacts you in a positive and negative way? What do you do that impacts me in a positive, negative way? How can we work this out together? That includes physical symptoms. I don't feel well, and also mental health symptoms. I'm anxious right now. So when you're anxious, what do you need from me? Having that conversation.
Right. What are some of the barriers you notice with the patient population that you manage? Like, are they having issues with the telehealth technology? How are they, are they having a hard time finding out the healthcare that they need? And what are some of the barriers that you are finding? Let's start with, well, Alex, your mic is open. Let's just ask you first.
And this is probably nuanced per person and also depends on each panelist here. For me specifically, it's challenging navigating some insurance plans, and I'm helping folks find a mental health care provider. And it's really difficult right now because mental health care providers are impacted, and there's not really a mechanism for any of us to point somebody in the direction of a provider that has available space. And I would love to be able to show somebody an online resource or ability to call and say, I would like to get in for an appointment. But that's just not how it is right now. I would love for that to change.
Well, you brought up insurance. We've got two amazing people here, Sylvia and David, that can probably give a little insight on that. What are you guys hearing about?
Well, I've tried to work with Alex here, and it's really difficult with the Medi-Cal HMO plans. It just seems that we can't find a provider or there's nothing available. So we've actually reached out to Mesa Vista just to see if they have any resources available that can help our patients. So we're still working on that. So hopefully we'll have more to report next time. But I agree with Alex. It's a barrier.
Yeah, me too. I do agree with Alex. It's a barrier. I've noticed a lot of our patients, especially our Spanish-speaking patients, that are seeking help, professional help. They've been doing telemedicine with psychologists in Mexico, all over the country in Mexico, which is great because again, it's in their own language sometimes. And second, they do have that fear as to what's going to happen next, just not just financially. But with the safety also, they want to make sure that the place that they're going to is having all the precautions available, not just with our dialysis patients, but also with our CKD population who wants to make sure that they can go to a lab if they're immunocompromised. So it's a big challenge, but I'm glad that a lot of people are seeking help, not just CKD patients, but people in general. The pandemic has affected everybody.
Right. So what type of strategies have you noticed facilities or physicians use to encourage patients to continue treatment during the pandemic? Who shall I call? Sandra.
Well, the most important strategy is patient education. This communicating with the patient, having this connection with them, making them know that we do understand how they feel. We're there with them every time they have their treatments. But patient education from the physicians, from the staff in the floor, everyone that is in contact with these patients, we're doing a little bit of education, and that's all that's the number one thing we can do right now. And showing them, not just saying, but showing them that that we are taking all the precautions and doing everything we can to keep them safe.
How about you, Cindy? What are some of the strategies you've noticed facilities or that you are using to encourage patients to continue the treatment?
Yeah, I mean, I don't know. To encourage for example, patients, well, first of all, I think part of the problem that I have right now with telehealth sometimes with what I do is because some patients don't have the same understanding of how to use technology that some of us do. So that is kind of a barrier in itself because they don't have the same fluency and understanding how to navigate on their phone or how to use the video. So for me to really be effective, I think most of the time is that patient contact in the clinic. So I've kind of had to get creative, and really understand where my patients are coming from, and find out, making sure that they're getting their labs done, making sure that they've had good follow-up with their physician, making sure that they're feeling okay with their living situation, and just really trying to help them navigate and optimize their care overall. But I think some of the strategies really has just been assuring them that, we have the vaccine. People are getting vaccinated. I mean, other than that, and just kind of giving them that assurance about vaccines. I mean, and that, people are wearing masks in the clinics when they come into the facilities. Everybody's getting screened when they come into the clinic. There's a whole dialogue of patients when they come in and questions that they have to answer before coming into the clinic. So that's kind of what I have to share on that.
Thank you. I have an interesting question here. How has COVID impacted dialysis patients as far as, is there now a greater need to focus on the access to home dialysis because of the pandemic? Sandra?
For sure, for sure.
Yeah.
And so we all know, Fresenius partnership with Balboa Nephrology, we know the need to promote home therapies because they will benefit from going home and do the dialysis. So for that reason, we're creating more ways of bringing awareness of home therapies. Myself in my role, I do what we said lobby days, even though I'm not in the lobby inside the clinic. We are outside the clinic, so we go clinic by clinic. We stay outside. We have patient advocates. We partnership with Next Stage, just so we talk to every patient that is coming in or leaving the clinic so they know about home therapies. I do lunch and learns for the clinic, so I educate the staff so they know how to talk to patients. So every opportunity they have, they can share the options of going home so they can do the dialysis at home. We have this program we call Experience the Difference. Very excited about that. We have a station in some of the clinics with a Next Stage machine. So patients are invited to test the machine. So they are scheduled for 2 weeks, 5 days for 2 weeks, so they can experience the machine and they feel the difference, and hopefully that will make them excited about going home. And a lot of those patients, that makes the difference on making a decision and committing to go home.
Yeah, I want to say, I took a tour. There's a new facility for a Fresenius facility in Kearney Mesa, and it is awesome. It's exactly what you're saying. I was excited about it because I was on dialysis, 20 years ago, but it was nothing like this. I was on peritoneal dialysis. And the manual version of it, and I didn't have that type of training or that kind of immersion into it. And I just think it's such a wonderful introduction to people, because most of the time, and Dennis, let me know what your thoughts are on this too, but when people are diagnosed with CKD, it's a shock. It's like people don't really think about their kidneys. And so that's why I'm so excited to be a part of ReMend, and have others, the mentors share their experiences about how, they were diagnosed. But then to have programs like Fresenius is doing is pretty amazing. So it's a really cool setup there in Kearney Mesa. So Dennis, tell us a little bit about your situation, your kidney journey.
I've had kidney disease my whole life, but got a transplant in 2010. And I thought I understood what was involved with getting a transplant, the drugs and everything after that. And, you live and learn. The best thing, the partner that I've had for the last 22 years, aside from my wife, she's got to hear that, but is my nephrologist, because he's been through the whole thing with me. And especially in the pandemic, it was tough to just use telemedicine and see him on the computer screen. But I followed his lead, and not only when it came to the drugs or any ups and downs and when you get lab tests, but really how to learn enough about the virus, but not get paranoid about it. So, as with anybody with the transplant, there's ups and downs with the medicine and lots of lab tests. And once you make it through that, you go partner with your doctor. I think that you've got a lot of knowledge between the two of you. So that's how it's got me through all this.
Yeah, I think you're kind of a unique situation, because you really have partnered with your physicians throughout the years. And so not everybody realizes that's, something that they can do. I don't know if they're supposed to be able to do that, but
well, the point on that, though, is that I better understand my situation. I better understand the drugs. I better be compliant. I better have a bubble around me, when it comes to who I'm with. So it's give and take, but it's a mutual respect.
Right.
So, yeah, I guess I am lucky.
Thank you. Hey, Alex, what are some of the disparities you've noticed pertaining to mental health of dialysis patients during COVID compared to the period preceding the pandemic? Are there differences, big differences, or what's your input on that?
Yeah, so sorry, I'm not in a position to answer this actually, because I started working exclusively with dialysis patients after COVID hit. So I'm not able to compare. I would love to see some data on that.
Okay. How about Sandra? Have you noticed the difference, a big difference in the reaction to dialysis patients with regards to, you know, questions that they've had pre-pandemic and now?
Not a big difference, not really.
They're really all the same.
Yeah, they know dialysis is their life, and we just continue doing what we do, but they are showing up for the treatments. They are doing what they're supposed to do, the best that they can.
Well, I do want to point out some positive effects of things happening during the pandemic. Like, people are spending more time with family, people are eating at home more often. What are some positive effects you have noticed with patients overall?
I'm gonna go back to home therapies. We've seen a lot more patients interested in coming home to dialysis, you know, and so that's a very positive impact. I think, you know, because they always have been in that position that they need dialysis, they have the family support always been there. So, but I'm gonna say home therapy's interest has been raised by far. Yes.
Good. David and Sylvia, I'm going to jump into some financial questions. So what are some of the treatment-related expenses patients can expect, like insurance premiums, transportation, things like that? What are some, you know, things that they'd be surprised to learn that they have to expect because they now have CKD or they're on dialysis? David?
Yeah, sure. So it's a lot of things that you mentioned: transportation, cost. You know, most patients who begin treatments at one point, they're going to be entitled to Medicare benefits, which would make them responsible for 20% coinsurance for treatment. That 20% usually translates to, for in-center dialysis treatments, usually translates to about $800 a month. So a lot of people don't know that, and they say, how am I going to pay for this kind of treatment? There's no way. And my job is to let them know the resources that are available for ESRD patients, you know, whether it be Ticket to Work program, the transportation benefit, the Medi-Cal program, how to obtain secondary insurance through Medigap, educate patients in San Diego County on the 73 different Medicare Advantage plans that are available, educating them on their benefits, options, their rights, and most importantly, their responsibility, so they can learn how to advocate for themselves. Not just that, but I mean, other services that might be available to help through different organizations: American Kidney Fund, National Kidney Fund, Kidney Quest, a lot of resources that they, that being on this, or having end-stage renal disease opens a window to disability benefits, state disability benefits. And it all helps. It all helps all our patients, but it stresses them out too. I mean, receiving bills every month for treatment, you know, eventually it starts looking like Valentine's Day in their dining room table with all the pink and red bills. It's not something that you want to see, even if you've made arrangements for payment or you have secondary coverage where you're not supposed to be getting these bills. And contacting the organization that is billing you is sometimes a challenge. So that's what I see a lot. But there's a lot of resources out there. Thankful for them.
Sylvia, what are your thoughts on that? What are some of the things that patients can expect? Maybe David didn't cover.
Well, for us, when they start the evaluation process, just making sure that we are going over their benefits, because We've had a patient call asking, why am I getting a bill for this? So every time they come to the lab, they may have a copay or a coinsurance. So just making sure that they understand and know that when they are going to start their evaluation process and even the maintenance, if they have a copay and you don't have a secondary insurance, that you will be responsible for that coinsurance or copay. But we also talk to them in the very beginning. They have a financial coordinator that meets with them individually and they go over their transplant benefits, living donor benefits, pharmacy benefits. And we also provide a lot of education and resources. If they have a high share of costs with Medi-Cal, we talk to them about that too. We tell them about the Working Disabled program, and a lot of our patients do qualify. It's just a matter of getting them to make that call.
And I just want to chime in that Sylvia and her team are amazing on making that happen to get our patients transplanted. They will sit with the patients. They will be on the phone for hours with insurance companies to make sure that we could get our patients on the wait list and hopefully get them transplanted.
Wow.
Yep. And we also look at the post-transplant too, make sure that they understand and that they will have coverage after transplant, not just before the transplant. The long term.
So how long? I mean, once you have that transplant, how long does that coverage last?
Well,
And what
it all
does it
depends.
Okay.
It all depends, right? If it's a commercial insurance, if it's an employer group health plan, then as long as they continue to work, they'll have the coverage. If it's Medi-Cal, we make sure to tell them, you're going to need Medi-Cal. You're going to need some type of coverage because you have to take immunosuppression medication for the rest of your life. We explain Medicare. If they have Medicare solely because of ESRD, that Medicare is going to term 3 years after transplant. So just making sure that they understand that piece and that they are prepared for the long term.
Well, you bring up Medicare, and I wanted to talk about prescriptions, which could literally be a whole topic on its own. Maybe we could talk about that later. But can you explain Medicare Part D versus private insurance prescription drug plans? And Sylvia and David are experts on this. So who wants to go first? David?
I can start.
Sylvia? Okay.
Okay. Well, I just wanted to say, if the patient has Medicare A and B and D, and it's part of the transplant, Medicare Part B will cover the immunosuppression drugs at 80%. So that if they have a secondary, that's great. They'll have that coverage. And any other non-immunosuppression drug is covered under Part D. So like Valside is one of the medications that some of our patients have to take. That's usually, it's covered under Part D. It is a high copay. It's the same thing with the commercial plans. It's usually a very high copay. But we do work with them. We go over their pharmacy benefits right before transplant if we can, especially if they have a living donor transplant scheduled. We do meet with them right before their transplant so that they are prepared. We have Sharp has a pharmacy assistance program, so we can reach out to them. We have been very successful in getting patients approved for these programs. We have copay cards, so we do the best that we can to help our patients and be able to afford their medication.
Wow,
Sharp
that's
also
awesome.
has pharmacists. So we have at the Transplant Center 2 pharmacists that will also help and ensure that the medication's covered as well, be pre and post-transplant, and work with the financial counselors. We also ensure if something is going to be high cost, that sometimes we work with the pharmaceutical companies as well, the drug companies, to see if we could get discounts through them. Certain drug companies offer discounts for our patients as well. So a lot of resources out there that people are unaware of. And then I just want to comment about, you were alluding to the cost of immunosuppressive therapy and transplant, which, as we know, can be very expensive.
Right.
But the Immuno bill did pass, and it's going to go into effect in 2023, where right now Medicare is covering immunosuppressive therapy 3 years post-transplant. But now that that Immuno bill passed, it will be for the lifetime of the transplant, which is very exciting for those individuals undergoing kidney transplant.
Yeah, very exciting. Wow. So, well, how do people, we'll come back to you, David, on that too, but I just want to know, how do your patients know that these resources are available to them? Through their transplant team, or what's the process for them to learn about this?
So as Sylvia mentioned, everybody is assigned a financial coordinator. So when we get a referral for a transplant evaluation, there is a specific financial coordinator that oversees them through their journey. Sits down with the individual, counsels them, helps them, is on the phone, advocating for them with the insurance companies. There's even times that Sylvia and I will call the medical director of insurance companies to advocate for these patients or get them the documentation that they need. That is our job, to be advocates for anybody who wants a transplant. So a lot of resources.
Yeah, thank you. Thank you so much for that. David, how about you? What's your experience with explaining Medicare Part D versus a private insurance to some of the patients you work with?
So yeah, so Medicare Part D is incredibly complicated, but especially for our patients who, you know, are just sent the Medicare and you manual and they're expected to read it. But just want to mention that Sylvia's team and Christine's team is absolutely fantastic. Jamaya in your prescription assistance program absolutely does a great job. Her and her team also. I use them a lot for resources, and they give me a call whenever a patient might have some other type of need. So we all work together. We all network together, which is great. But yeah, you guys at Sharp, a fantastic group that you have. Yeah, Paige, you know, and she did a great explanation of how immunosuppressant drugs are covered, but those medications that are not covered under Medicare Part B, they're going to be covered under Medicare Part D. Medicare Part D has been privatized, so you have to actually purchase a policy. Policy can range anywhere between $12.50 up to $130 a monthly premium. Besides that, you still have to pay the co-payments, the co-payments, the premium, and the deductibles for medication coverage, which means basically at the beginning of the year, you're going to be paying a lot for your medications. And not just that, but medications are divided into different tiers. There's a tier system. For tier 1 usually is generic drugs, which are cheaper. They call them preferred generic drugs. Tier 2 is your regular generic drugs. Tier 3, your preferred brand name drugs. Tier 4, your non-preferred brand name drugs. And Tier 5, your specialty drugs that usually have a 33% co-insurance for a 1 month supply of these medications. Besides that, there's a phase system to the coverage. So not just dividing medication, but dividing the coverage into different phases. You have the initial phase, which is the deductible. You have the next phase, which is the regular coverage, where you pay depending on the tiering system. Then you have the donut hole, you know, the gap to the coverage, where you pay certain amounts. And then you have what's called the catastrophic phase, which isn't actually that bad, and they should actually change the name to it because it's very scary. But catastrophic phase will reduce your drug costs dramatically. So I can get more into it, but like you said, it's whole books are written about this type of benefit that makes it really complicated. Besides that, you have your maintenance drugs, you have your medications that require authorizations for, and the thing is with different plans, different drugs are in different tiers. Some medications require authorizations with certain plans, with other plans they don't. And there's 32 different Medicare Advantage plans, I'm sorry, Medicare Part D plans that are available in California. Choose the right one takes a little bit of research, and that's part of my job. Again, Sylvia's team, that they've done an incredible job with that also.
It's awesome to hear that you guys work together. I love that. I mean, David, you have probably the most knowledgeable and resourceful person that I have met within this, you know, this area. I mean, you've actually sent me a bunch of resources that I'm going to put up on the screen for people to check out. One more question. Why, this is kind of weird that I'm just bringing this up, but why is Cobra so expensive? Like why, okay, so can you explain exactly what Cobra is, David, and why it's so expensive for some people?
Yeah, so the Cobra program is a continuation of your employer group health plan. So basically, when an individual loses their job, their employer, in most cases, will offer the continuation of their employer group health plan. The downside is that they will no longer subsidize the premium, which means that you have to pay up the entire premium, which can range anywhere between $1,200 to $1,500 I've seen a month for the continuation of one's coverage. Besides that, you have, well, I should say, thankfully, due to the American Rescue Plan that was signed by President Biden, the premiums from April to September are covered at 100%, which is completely subsidized by the government, which is fantastic. But after that, you have to choose whether you can continue on that type of coverage, or we'll have to look elsewhere, for example, via the Affordable Care Act, the ACA, Obamacare, whatever you want to call it. But there's other resources within that program that the American Rescue Plan put into effect. For example, if a patient lost their job and applied for unemployment insurance benefits, they might be able to get coverage for the entire rest of the year and the following year till the end of 2022 for just $1 a month, as long as they've applied for or received unemployment benefits throughout the year, which is great help for $1 a month. Pretty comprehensive health coverage isn't bad at all. That's again, really good coverage based on
Wow.
your medical needs and stuff. So
Let me share this screen and show you guys what some of the stuff that he's talking about here. Can you all see my screen? Cool. So these are a couple of the resources that we wanted to offer you. I know there's a couple of web addresses, but I don't have all of them on here, but I will post these resources on the ReMend website, a link from our social media, and this information will also be on bnmg.org through their blog as well. I do have a quick question that's going back to the home therapy. Dale, let's see. Dale wanted to know what is involved with home therapy and is it set up for hemodialysis?
Yes. So yes, you can. I assume that question is for one of us.
For you, Sandra. Jump on in.
So home hemodialysis is also available to do it at home. What involves is a little bit more training. Once you have your fistula ready, you're scheduled for training about 4 to 6 weeks, 5 days per week. As you do your training, you're getting your own dialysis. So, you know, everyone is familiar, or most people are familiar with peritoneal dialysis. But so that's why we are bringing awareness of the option to do hemo too.
Yeah, I did hemo with, I did hemo and PD. So I did in-center and then also PD, I did the manual, but I never had the chance to try, you know, the in-center hemo. It looks pretty cool and very, I mean, it's serious. I mean, there's some serious training that goes into it, but it really offers a lot of freedom to a patient, like their schedule. You know, if you can do it in the evening, you can do it anytime that's going to work for you rather than going to in-center 3 or 4 times a week and sitting in a chair for 3 to 4 hours. Is that kind of accurate? What I'm
Yes, you're correct, Kiko. So at home, you do it 5 days a week, average time of 3 hours, based on your weight. But you can do it anytime you want to do it. You don't have to follow a schedule. One day you can do it in the morning, another day at night, whenever fits your schedule. So dialysis is around your schedule versus the opposite, right? So, and you feel better.
And you're able to travel with that. Like you can take that setup with you if you have a business trip or whatever. You know, you're able to.
Correct.
Awesome.
Yes, correct. The cycler is portable. Same thing like peritoneal dialysis. You take your machine, and we will make sure to deliver the supplies that you need to wherever you go here in the United States.
So we're closing in on time, but I want to do my lightning round here. I'm wanting all of you to let me know what you'd like, people that are watching, what you'd like them to take away from our discussion today. Let's start with Cindy.
have to unmute, sorry.
Put you on the spot. Sorry.
Yeah, no, that's good. Of course, home therapies is a tremendous opportunity for our patients now. And I just really want to emphasize that this is our new default, and home therapies, meaning home hemodialysis and also peritoneal dialysis. And I also want patients to take away that there are so many resources for them out there. I mean, we've got resources at Sharp for Sharp Transplant. We've got resources for navigating insurance, for your mental health, for your nurses, for your educators. So what the audience to learn is just how to reach out for those resources. To pick up the phone, call, figure who's the point of contact. And sometimes as a nurse, I feel like I really need to give patients that knowledge, this is how you call, and give them those tools, how to be an advocate for themselves. So we have the resources available. There's a lot of people to help you with your kidney disease. And we're here for you. And we have a great team, a really good, knowledgeable team.
Thank you. Sylvia and Christine, what would you like people to take away from this conversation today?
Well, I'm going to put my nurse hat on like Cindy, and really it's all about relationships and trust and building that relationship with your patients. And the biggest thing for people to take away today is that you're not alone. You have forums like this. You have everybody here that is willing to support you and guide you through your journey. And I think it's really important that not only we advocate for you, but that you advocate for yourself. And we're always available. So you want to pick up the phone, we have a nurse 24/7 on call. I know sometimes they'll get a call at 2 a.m. of I can't sleep and I'm scared, I'm nervous. And, just to reiterate, we are here for you. So I think that's the most important thing to take away as, we go along this journey together.
Thank you. Sylvia, what are your thoughts?
Just kind of what Cindy said, don't be afraid to reach out. There are so many resources available. I have a team of experts here that will work with you. We will try to help you. If you are not sure if your insurance covers transplant, give us a call. We will tell you. And if you need to change, we will guide you through the process as well and make sure that you have coverage for dialysis and transplant. So just don't be afraid. We are here to help you.
I love that. Alex, what would you like people to take away from today?
Yeah, I'd love folks to remember, it's okay to figure out how to take care of you, right? Start with this idea of grace and compassion for yourself, and then decide what you need. Is that sleep? All life is a work in progress. How can you better sleep? Maybe it's some exercise. Maybe it's working on the diet. Maybe it's reaching out to others to get social support. Finding that interest and hobby that you've been wanting to work on for a while. Even this idea of inner focus too. We do this all through mindfulness. What's mindfulness? Just awareness of the present moment with no judgment. I mean, how cool is that to be mindful of our thoughts right now, but not judge them? Mindful of my impact on other people without judging it. Mindful of other people's impact on me without judging it. Let's start right there. And then we can all improve together and do that together.
I wanted to talk about that too, because I actually have one of those. I have two apps, the Calm app and the 10% Happier app. Are those things that you talk to patients about as well?
Yep,
it's been helpful to me.
I encourage folks to shop around because there's some apps that work better than others. And there's so many resources for mindfulness. I even encourage folks to find a script that they like and record that script, or have somebody who they think has a soothing voice record that script into their phone, and then they can play it before bed when they need a break. So they have this accessible. Definitely, some of those apps are getting better and better over time.
I love the Calm app. I listen to it all the time. And speaking of soothing voices, Dennis, let's hear that. Do you have a takeaway? You're muted right now. Do you have a takeaway as being the co-founder of ReMend? What would you like people to take away from our conversation today?
The one thing that this is going to sound strange, but if you were ever to have kidney disease, now's the time to have it. Simply because the amount of technology of the dialysis machines, the precision of the drug management, the amount of people that are out there to help you. I mean, listen to the call here. Everybody wants to help. And then the financial considerations that were done in Washington to pay for your transplant drugs the rest of your life. There's really not much standing in the way of getting a transplant right now, other than an education program and maybe talk to a mentor or somebody else. To be able to go get home dialysis before you go in center, to be able to go reach out to a prospective donor and get help. I don't want to say it's an easy disease, but there's a lot of people in San Diego, not only between Sharp and Fresenius and the other dialysis companies in Balboa, that are here to help you. So you're in the right place at the right time.
Thank you. David, what would you like people to take away from our conversation today?
Well, just that there's a lot of resources out there for everybody. And primarily, if you're a Balboa nephrology patient, I want you to take away my information. David Ordaz, patient financial counselor for Balboa nephrology. If you need any resources, feel free to give me a call, and I'll properly screen you for coverage, for resources in the community, state, federal level, county level, just to make sure you have all your bases covered. Yeah.
That is so awesome of you. Thank you. And people, you can check David out on bnmg.org as well. There's a little get to know David on the bnmg.org blog. So thank you for that, David. Sandra, I don't think we got to you about what you'd like people to take away from today's discussion.
Well, just to add to what everyone has said, COVID has brought a lot of challenges, new challenges for providers and patients as well. And I just want you to know that we all working together, and that's the only one who can face these challenges by working together towards the one common goal, which is taking care of our patients, giving the best care and protecting our patients. So we're here for you.
Awesome. Thank you so much. I wanted to share my screen one more time. So thank you for joining us today. There was a lot of really helpful information and wonderful, let me just thank you all for being such wonderful panelists. I couldn't have asked for more. Our next discussion is going to be September 30th. I think I might know what it's going to be, but I'd still like to hear what people would like to discuss. I think having this discussion about financial wellness and just guiding you through Medicare and all of the different difficult programs, that might be something we discuss in September. But if you have any questions, ReMend is here too, where we also say you're not alone, where again, we are a group of patients that have committed to helping other patients along their kidney journey. We share our experience, and hopefully other patients can pull from that and just kind of make the situation a little bit easier to go through. So please, you can reach out to us at remend.org. Our number is also 858-650-5001. We're also on Facebook and Instagram. If we didn't get to your question today, let me just make another quick, David put his info in the chat, everyone. Look at you, so resourceful. Right on. So thank you, everyone. This has been fantastic. Look for us next month, and please reach out. You're not alone. Thank you, everyone. Thanks, Cindy, Alex, Sylvia, Christine, Sandra,
Thank you.
Dennis, David. Have a great day.
Well done, Kiku.
Thank you.